All right, ladies, so today we are going to talk about hysterectomy. So you've been told that you have to have a hysterectomy. So I can tell you firsthand, these are some of the things that you want to make sure that you take a look at before you have a hysterectomy. And the first thing is that you want to look at is your labs. You want to take a look at your labs and you want to take a look at where your hormones are at before you have a hysterectomy. And I'm speaking firsthand. I have had a hysterectomy and I did labs because I wanted to see where my numbers were before I had a hysterectomy. Now there's many different types of hysterectomies. There's a full hysterectomy, there's partial hysterectomy. I was able to keep my ovaries. However, my uterus and my cervix was removed, as well as the fallopian tubes. Now, when you keep your ovaries, you are still getting some type of blood supply where you're still going to be producing estrogen. And estrogen is just not only produced in the ovaries, it's also produced in the tissue. So you will always produce estrogen, but just not at the same rate you would if you had your fallopian tube. So my estrogen levels was extremely low. My pregnenolone, which is the mother hormone that governs all of the other hormones, was non-existent. Progesterone level, which needs to be balanced with estrogen, non-existent. DHEA, androgen hormones, that's going to give me energy, that's going to help with my adrenal glands, was very low. On top of that, my ferritin levels, iron saturation, all these numbers low. I'm in the health field. And we tend to put so much into others to where we tend to neglect ourselves. So with me taking a look at my labs and having a hysterectomy scheduled for 2 months, what I did was I upped my supplements to try to get my iron and ferritin numbers as high as possible before the surgery. I took pregnenolone because it's going to help, one, with my cognitive function, is going to help to convert into other hormones. It's also going to help with my adrenal function. And then I put myself on natural DHEA. Now, DHEA is a really good hormone because it can convert into estrogen as well as testosterone. So I was covering two birds at one stone. And then I was using a progesterone cream at nighttime because keep in mind that I was trying to increase my estrogen levels, but at the same time, I needed to bring my progesterone levels up. I say all this to say it's because I have heard so many different stories. I've watched so many different YouTube videos, TikTok videos. I'm in Reddit forums and I am hearing women say, oh my gosh, I had a hysterectomy. I'm depressed. I was sad. I started having night sweats. Some women said after they had the surgery that they lost weight, but then they also noticed within 6 to 8 months, they started to put the weight back on. So if you plan to have a hysterectomy, I think that these are some of the things that you should advocate to have your doctor look at, or go to a practitioner that's willing to do these tests and prepare your body. There is no reason why you have to have a hysterectomy. Your hormones is going to take a hit, especially if you're having a total hysterectomy. Ladies, if you have a total hysterectomy, you're guaranteed to go into automatic menopause. And what that means is that at a certain point, these are some of the things that can take place. You can become pre-diabetic. Your insulin levels can start creeping up. Why? Because DHEA levels can also help regulate your insulin and your A1C markers. Your cholesterol levels can become elevated. Why? Because hormones is made from cholesterol. We see women that become hypertensive, and you're at risk for dementia. Why? Because your brain needs vital hormones to be able to function. Your heart health needs vital hormones to be able to function. So I just wanted to share this information because I feel like I was very well prepared. I didn't have any of the symptoms that I'm seeing that some of these women are having. You want to make sure that you're eating right. You want to make sure that you are preparing your body for these surgeries, such as eating fruit, staying away from things that's going to be more acid based and put your body in an acidic environment. Once your hormones is gone, you need to do everything that you need to do as far as working out, whether you're going to the gym, strength training, working out, doing Pilates, and doing infrared saunas. This is a new you, and you don't have to age if you take the appropriate steps to do the right things to keep you looking younger. So I just wanted to share this information because I think it's so vital. The traditional community is not putting a focus on women's health, and I think that that is something that's lacking. We are being set up for health issues so that a prescription can just be pushed and pushed and pushed. I see so many of my clients that come in and they're on all of these medications, and come to find out they had a hysterectomy 5-10 years ago. If they just had some hormone replacement therapy at an earlier age, a lot of these conditions could be prevented. And when we talk about hormone replacement therapy, a lot of people are, oh my gosh, I don't want to take hormones because I don't want to catch cancer. There is information and there are new studies that's coming out, and it is showing how women have been neglected, women have been lied to when it comes to hormone replacement therapy. It is very vital for your health, and if it's done correctly, hormone replacement therapy is not out here causing cancer. These synthetic hormones that's being pushed to you and young women in birth control, these are the hormones that you want to look at and you want to be concerned about, because these are the ones that's contributing to cancer. You can Google this, you can look at the studies. Estrogen is very important because it helps to fight off certain types of cancers. So if you like this video, please like and subscribe, guys, and until next time, take care.